Hello again. Pain is a funny kind of thing. If we were to present with any pain, physical pain in our body to a physician, we're likely to get given some kind of diagnosis around which is based upon the idea of locating the position that the pain is in, identifying what that structure is that hurts, and we do this by referring to an anatomy book or experience, and then having an idea about what could be wrong with this specific area. So with knee pain, for example, we have a pain maybe on the outside of the knee, the lateral side. It could be that it's Iliotibial Band syndrome, for example, or it could be a tear on the lateral meniscus, whereas below the kneecap could be patellofemoral syndrome or instability, and on the other side, the medial side, it could be some kind of bursitis. So we've taken the location of the pain and reduced it to the anatomy that we can understand, but there are a couple of things wrong with this approach. Firstly, anatomy itself is quite often wrong. Okay, let me be a bit kinder. It is always at best incomplete and at worst disastrously wrong. I'm not sure that was much better, but let's go with it anyway. This has been my common complaint about anatomy for years, which is that it reduces the parts of the body to individualized names. When we look in a book, we don't see what has been taken away, but instead we see the bits that are named, and those are the things we have to learn in order to learn anatomy. But none of the names suggest or imply connection or what they might do when linked with other things or what's missing from the picture you're looking at. Nope, it's just a muscle and a name. Generally speaking, anatomy names are given to things by old, dead, white men. This week I wanted to present to you the idea that maybe the lateral knee pain that someone might present with might not be just the knee, and maybe we can think about a structure in there that might set us off on a different train of thought. As a starting point, let's consider the tissue that wraps around the whole of the leg. Now, you'll have heard of the iliotibial band, the ITB, and I'll deal with the fact that it doesn't really exist in the way that we think it does in another video. Watch out for that. But for the moment, let's look at the rest of the wrapping that is around this lower limb. So you can see all this thick fascial tissue that sits around the leg, and all of this stuff that you can see is functional. I mean, everything in the body is functional, but this stuff is going to get trimmed away during the dissection process to get to and show the muscle. But that doesn't mean that the stuff that is now in the bin doesn't or didn't have purpose, or that it didn't contribute to function, because it does. You take all that stuff away when you're alive and you wouldn't be able to stand up. But underneath all this is one particular structure that I want to point out to you as being a potential culprit for the lateral knee pain that you see experienced by, particularly often by runners. So the best way to get to this place is to have you feel it on yourself. And we're looking at the lateral side of the knee. So if you feel down the outside of your leg, your knee, you'll find this bit that sticks out just below the knee joint. And this bony prominence just beneath here is the top of the fibula. And underneath here, if you kind of curve your fingers around and poke into it, you might find a really tender spot. And as I said, it can be really tender. So look out. What attaches up here and actually beyond this in terms of its fascia is a muscle called the Fibularis Longus. Now, Fibularis used to be called Peroneus, actually, as a Peroneus Longus, and now it's been changed to Fibularis, presumably because people got confused between that and the perineum. The other fibularis is the Fibularis brevis, the short fibula, and that's further down the fibula, and it blends strongly with the lower part of the Fibularis longus, but and then sort of joins up to it as well, where it carries on down. Now there is a third fibularis muscle, which is the Fibularis Tertius, but this is even further down and sort of more anterior, and we'll leave that for now. Anyway, these two lateral muscles are really interesting because as they go down the leg, they become very tendinous and run underneath this retaining fibers, the retinaculum, behind the ankle bone, right up inside and right up on the outside of the ankle here. And as they do this, they kind of hook right in this little space deeply, right up and in there, and create like a little leverage and like a little pulley around the ankle as it heads towards the foot. Now the brevis, the short one, stops right on the edge here, right on this little bit of the edge of the foot, on the first bone that's going to become the little toe, the fifth metatarsal. But the longus muscle, the Fibularis longus, goes all the way across the underside of the arch of the foot and attaches right up here onto the medial side, and it attaches to the base of the first metatarsal of the big toe. So it's right up onto here. So essentially there's this massively long muscle that is traveling down essentially from all the way from the, from the knee down to the lateral malleolus and across the foot towards the big toe, forming a kind of a stirrup. So its job is to help to support the arch of the foot, but also works in plantar flexion, the pointing down and moving down of the foot. But it also helps to invert the foot, so turn the foot outwards in this action. So if you're lying face up and your sort of legs and feet are relaxed, your feet will tend to turn in naturally when you're in this relaxed position. Now when you stand up, what you need is your feet to be held out into of this inversion into eversion, and that's what the Fibularis longus is helping to do. Now as far as runners are concerned, well, I don't know if you've ever watched people run, but there are some funny things that people do with their feet when they're running. So if someone's landing on one side or the other of their feet, even when they're running, even slightly, you can understand how much of a tug is going to be placed upon this long muscle where it sort of comes up and attaches to this bone, which is really near the knee. So above the fibula, and in effect blending directly into the fibularis, are the structures of the long and short head of the biceps femoris. So, one side of the hamstring, in other words. So where are we? Let's check back in. What we're looking at is a major tensional junction of the hamstrings where they meet, and they meet at another point where they meet a really long muscle that is running down the leg and across the foot to the opposite side. So if you imagine this in engineering terms, it's going to be a weak point because there's a big joint in there, but also there's going to be a huge combination of load bearing and force transference going on, and at the same time there still needs to be a lot of movement and flexibility. So try building that, and not only building it but making it last 80 years while it's massively loaded. But you can see why it might hurt. So the question is it an issue with the hamstring, or is it an issue coming from the foot? How the hell should I know? You're the therapist, you sort it out. But what it will do is give all the appearance of being a knee issue. There may be swelling, fluid in there, tenderness, heat. I mean, it's a big loaded area. Why wouldn't it get hot, right? What do? Hey presto, let's have an MRI and have a little look at the lateral cartilage. This, however, is where another problem can start to present itself. We're taking a picture of the knee, but we don't know the state of the lateral collateral ligaments before the image was taken. You get somebody that has been running for years, and we could see that they've taken a bit of a hammering to this cartilage, and it might look a bit ropey. Like a bulging disc, it doesn't mean that the ligaments are the problem by themselves, just that we're seeing the picture and putting two and two together. When anatomy is badly, or only partially taught to doctors and surgeons, which it is, then they're not going to consider this relationship of fibularis to the biceps femoris and the functional tissues that surround it, because why would they? The image that we've got shows damage to the ligament and of the surrounding tissue, and all the diagnostic tools and the textbooks tell us what the problem is, although they're all based on the same anatomy, which is flawed. But anyway, boom, we've got our suspect, bang to rights, case closed. The application of hands-on work and movement work, not just in this area, but also on the structures a lot further away, into the foot and further up into the hamstrings, really does have a huge impact on this area and resolving certain presentations of pain in my experience. Take a look also at the shoes that people might be wearing, and if you've got runners, get them to bring their shoes. And this might help you to see what loading is going on through the wear on them, especially if it's not even both sides. Now, some runners will have shoes that account for this movement. I'm not massively keen myself, but anyway. Take a look at also how they walk or run. Go outside and have a walk with them, have a little look. The moment you see any slight inversion or eversion or change in the foot position during a run or a walk, then you can be sure that at the very least this area up in here is going to be pulled and unloaded evenly. It's the end of a long lever. If in doubt, you can always just stick your fingers underneath this bone and see if they scream. They quite often do. So there we go, fibularis, something to consider when you're being presented with knee pain. And there's lots of other things that you could also do with, you know, medial or lower knee pain. So what do you think? Do you see runners? Does it get resolved? Have you seen this position of the feet? It's an interesting thing when you watch people running and have a little look on the telly at the marathon. Anyway, let me know what you think. Please put your comments in the comment section below. Please like and subscribe. I cannot tell you how much that helps me if you just like it and subscribe it. It's great. And it's the things we're supposed to do on social media. And I'll see you next time.